Hello, everybody, and thank you for joining us today for our special four-part webinar series on managing hypertension and diabetes patients by mastering Health IT. This is the third part of our series, and we'll be focusing on leveraging Health IT to engage and monitor hypertensive and diabetic patients. Our presenters are Bruce Mackey and Andy Petrovich, and my name is Leslie Kiesel. Before we get started, I have a few housekeeping details to cover. We'll be keeping the phone lines on mute, but if you have a question, please put it in the questions box. If we are unable to respond during the presentation, we'll answer all questions within 1 to 2 business days via email. We'll also post a video and a PDF of today's presentation on mceda.org. For those of you that don't know, the MCEDA program is largely grant funded and run through Altarum Institute. Altarum is a nonprofit with nearly 70 years of experience researching, developing, and implementing solutions that serve the public good by solving complex system problems to improve human health. Our staff members are leaders in identifying, understanding, and solving critical systems issues that impact health and healthcare. From designing and developing health information technology systems to working with healthcare providers to foster clinical quality improvements, Altarum is widely acknowledged by the federal government, the state of Michigan, and the private sector as a valued partner. We currently have over 400 employees across the country. Housed within Altarum, we are MCEDA, the Michigan Center for Effective IT Adoption. Originally born out of the HITECH Act, MCEDA is Michigan's regional extension center tasked with accelerating the selection, adoption, and meaningful use of Health IT to improve the quality and efficiency of healthcare in the state. To date, we have assisted over 5,700 providers across Michigan, impacting 1.6 million patients annually, and 1 out of every 4 Michigan providers who have been paid for meaningful use is an MCEDA client. Our services are highly subsidized for qualified providers. Paired with our fee-for-service packages, our services include meaningful use support for any stage in any year, security risk assessments, targeted process optimization, which is an adapted version of lean principles and applies it to clinical or operational practice improvement initiatives. So no matter what you need help with in terms of improvement within your practice, we have the experts on hand to help. Finally, we have attestation and audit preparation assistance for those in need of one-on-one assistance before attestation or after an audit letter is received. In today's presentation, we'll take a few moments to briefly discuss the health problems we're focused on, hypertension and diabetes. From there, Andy and Bruce will discuss the various ways you can leverage your Health IT to help engage and monitor these patient populations. Topics to be discussed include team-based care and chronic care model, e-health tools such as patient portals that enhance patient engagement, clinical quality measures, patient self-monitoring, electronic diabetes registries, and clinical decision support. In addition to the information that you'll learn today, our staff has developed a customized toolkit to guide your office with the recommendations from our series. When incorporated with your current processes, these tools can help ensure accuracy and improve the health of your patients. We will post the tools on mceda.org and we'll email them out to all attendees. With that, I'd like to turn things over to Andy to get started.
Thanks, Leslie. As she just mentioned, we'll start off by briefly discussing the pervasive chronic conditions we're focused on today, hypertension and diabetes. Heart disease and stroke are extremely serious problems in the U.S. They are currently the 1st and 4th leading causes of death in our country, with over 2 million heart attacks and strokes happening each year. 29.1 million people, or 9.3% of the population, have diabetes. The stats in our state are even worse, with an estimated 10% of Michigan adults diagnosed with diabetes, and an additional 250,000 Michigan residents are believed to be undiagnosed. As if that wasn't bad enough, the national and state numbers around hypertension are even worse, with approximately 70 million, or 1 out of 3 American adults affected by high blood pressure. Roughly 16% of Michigan's adult population does not have their hypertension under control. With disturbing figures like these, it's no wonder we continually see over 2 million heart attacks and strokes in our country each year. The strategies and tools we're discussing today can help to lower these alarming numbers. With the prevalence of these conditions in mind, we'd like to reintroduce you to the model at the heart of this educational series, the Health IT Patient Management Model. In a nutshell, it is a PDSA, or Plan, Do, Study, Act cycle that leverages Health IT to identify, engage, monitor, analyze, and improve the health of your diabetic and hypertensive patients. The rest of today's presentation focuses on just two of these functional areas, engaging and monitoring patients. Additional sessions focus on ways you can leverage your health IT to identify as well as analyze and improve the health of these patient populations. We'll begin by discussing ways you can leverage health IT to engage not only patients, but entire healthcare teams. In today's healthcare environment, there is increasing pressure on providers from all angles. Regulations, technology, medical innovations, and other factors are constantly reshaping the industry. In addition, patients are more demanding than ever before, expecting convenience, efficiency, and optimized results. Providers cannot meet these intense demands alone. 42% of primary care physicians report not having adequate time to spend with their patients. 50% of patients leave the office visit without understanding what their physician gave. Physicians, according to one study, interrupted patients' initial statement of their problem in an average of 23 seconds. In 25% of visits, the patient was unable to express his or her concerns at all. It takes 7 hours per working day per patient to provide all recommended preventive care to a panel of 2,500 patients, plus 10.6 hours to manage all chronic conditions adequately. These stark figures all point to the ever-increasing need for a medical practice to operate efficiently and effectively as a team. Team-based care is a necessary strategy for medical practices to thrive in today's environment. Let's begin discussing team engagement by referencing the chronic care model. The chronic care model consists of 6 elements working in concert to create productive interactions between an informed, activated patient and a prepared, proactive, and engaged practice team. The 6 elements are the community, the health system, self-management support, delivery system design, decision support, and clinical information systems. Key function of a multidisciplinary team is to provide continuous, supportive, and aggressive care for people with diabetes throughout the course of their disease. Identifying the roles of the team and actively engaging the entire team are essential in effectively treating patients with type 2 diabetes. Team composition may differ according to patient's needs, patient load, organizational constraints, resources, clinical setting, geographic location, and professional skills. An essential aspect of providing team-based care is to get patients on board as members of the team. Patient engagement is defined by the Institute for Health Improvement as the use of tools, activities, and relationships by and for both patients and care teams that promote shared decision-making and facilitate improved care outcomes for patients through empowerment. Ian Warden defines patient engagement as a person's sustained participation in managing their health in a way that creates the necessary self-efficacy to achieve physical, mental, and social well-being. Engaging patients in their health care is highly beneficial to patients and providers alike. Research shows that patients who are engaged in their health decisions are more likely to proactively engage in preventative and healthier behaviors, more effectively self-manage their health conditions, and experience improved health outcomes. The benefits realized by patients transfer to providers by having more meaningful and satisfying interactions with patients. Health IT and EHR have enormous potential to engage patients. When used effectively, Health IT and EHR can engage patients by fostering collaboration and communication between patients and providers, enabling electronic management of appointment schedules, facilitating quick and easy communication between patients and providers, giving providers a vehicle for convenient outreach to patients following office visits, hospital stays, as well as appointment reminders, offering patients access to full and accurate information about their care, and promoting chronic condition self-management. Results on the value of patient engagement are measurable and impressive. For example, through the use of patient engagement strategies including self-management and home health monitoring, the VA was able to reduce hospital admissions by about 20% and reduce treatment needs for diabetes, heart failure, and other chronic conditions by between 20 and 50%. In order to effectively engage patients, they need to be given the tools to help them succeed in managing their health. E-health tools and suites of tools are available to help support patients who are engaged in their care. Based on research from Kaiser Permanente, effective utilization of these tools can lead to reduced ER and urgent care visits, lower use of inpatient services, and reduced mortality rates in patient populations. E-health tools may already be available through your EHR. If you're not sure, check with your vendor. And if these tools are not available, it is possible to develop original tools for your EHR. And e-health tools are also available from third-party vendors to augment your existing EHR system. A prominent example of a powerful e-health tool is the patient portal, which in turn facilitates patient access to other tools. EHR patient portals are well known, largely thanks to being required for meaningful use, and have the potential to revolutionize the coordination and delivery of care. Let's explore how providers can get the most out of patient portals. Just making a portal available to patients will not ensure that they will use it. The portal must be engaging and user-friendly, and must support patient-centered outcomes. The portal also must be integrated into clinical encounters so the care team uses it to convey information, communicate with patients, and support self-care and decision-making as indicated. Practices have used their portals to successfully serve a wide range of patients, including those who are older, have lower incomes, or are chronically ill. Patients are likely to use a portal when it is recommended by their providers and has functionality that supports patient activation. Portal training and technical support also will help patients to make the most of its tools and services. To engage patients in the use of patient portals, key actions need to be undertaken. First, learn the benefits for patients and providers. This should be done by the entire healthcare team so that patients can be informed of the value of their portal access at each point of contact in the care delivery process. Implement proactive, participatory features that will draw patients in to use the portal. Implement the portal with a systematic process that is considerate of your practices and population's culture and priorities, and how the portal can be seamlessly integrated with patient care. Finally, actively promote and facilitate portal use to get the most value out of your investment. We will go into further detail on each of these topics, starting with the benefits of patient portals. Fears and other negative attitudes about patient portals are often dispelled when providers gain experience with a portal and see its benefits for their patients and their practice. Providers who have used portals successfully recognize positive benefits, including improved patient activation, more efficient and effective communication, better and more timely self-care among patients, the ability to focus better on high-priority patients, and improved patient satisfaction. Consider, besides learning the general benefits of patient portals, make sure you and your staff know about all the features in the portal you offer patients so you can explain them. You should take into account your practice's resources, culture, and priorities when planning the launch and implementation process. This will help build confidence and acceptance of the portal among clinicians, staff, and patients, while minimizing disruption in the practice. Federal Regional Extension Centers, or RECs, have experience with portal implementation. Ask your local REC to help you plan and launch your patient portal efforts. Key questions to answer during planning include: what are the goals for the portal in terms of potential benefits for patients and the practice? Which features and services should be offered? Should they be offered all at once or phased in? Will the portal be open initially to all interested patients or to a select group during early deployment? How will you handle marketing, enrollment, training, and support for patients' use of the portal? Rolling out your patient portal, use several strategies. The provider-controlled strategy begins with a smaller number of patients and interested providers. and achieve a base of experience and comfort with the patient portal before expanding. The team-focused strategy includes patients on the rollout team. It allows several months to assess how to integrate the portal, gathers patient and provider feedback to plan expanded implementation. The efficiency-driven strategy makes enrollment open to all patients, has staff manage portal workflow and communication before engaging providers directly, and aims to establish efficient workflows and policies and avoid burdening providers with troubleshooting during the initial rollout. A patient portal that only provides administrative functions, such as scheduling appointments and getting lab results, may not be as interesting or useful to patients. Patients will be more likely to use a portal that is designed and configured to address their personal interests and needs. Consider, patients will have different needs and interests regarding a portal tool depending on their health conditions and level of activation. A portal that includes interactive and personalized tools and information will be more relevant to patients' needs. Patients are more likely to register and continue using a portal that has a problem-solving orientation, interactive decision tools, and personalized messages and tools. Successful promotion of any new resource is not a one-and-done endeavor. If patients are exposed to the benefits of a portal frequently, they will be more likely to remember and initiate utilization. The whole staff should be involved in promoting the patient portal. One office can display signs or posters, staff can distribute information brochures, and providers can include standard talking points to introduce the portal during patient visits. Consider, patients are more likely to adopt and use a patient portal if their providers recommend and support portal use. Research shows that a team-based approach can improve patient utilization of EHR portals by about 25%. A valuable benefit to implementation of EHR patient portals is their ability to conveniently provide education to patients. Many EHRs have robust databases of patient education resources directly available. Again, if your EHR doesn't have these features built in, it is possible to develop them or obtain them from third-party vendors. Educational resources vary in purpose and format, but often fall into the categories of decision aids, self-management tools, mobile device applications, internet-based resources, and community resources. It is expected that an increasing percent of clinically relevant data will be collected outside clinical settings in the coming years. This highlights the demand patients have for medical information. Providing them with quality education through the EHR allows providers to set the stage for framing patient conditions and plans of care while empowering patients to make informed decisions based on accurate information. 72% of American adults use the internet for health information. Through the increasing use of cellular phones, tablets, and other mobile devices, patients have unprecedented access to a world of information and misinformation at their fingertips. Patients who use the EHR portal to get information on their health will be better off for several reasons. The information provided will be based on good data and evidence-based best practices. It's convenient for patients to access online using their normal devices. Information delivered can be tailored to patient conditions and diagnoses, and messaging delivered through the EHR portal is also consistent with messaging from the provider. The result is the creation of a potentially continuous chain of contact between provider and patient. Referral modules can be tailored to promote resources such as pharmacies and wellness centers, further cultivating a continuum of care that engages the patient where they're at in their homes. To sum it all up, patient engagement is most effective when the entire team is involved. Engaged patients experience better health outcomes. Electronic health records, patient portals, e-health tools, and education resources can improve patient engagement. At this point, we'll let Bruce Mackey tell us about patient monitoring.
Thanks, Andy. We'll now move on to ways you can leverage your health IT to monitor your patients. The concept of monitoring is by no means a complex one. However, the actions that surround monitoring, especially as it relates to chronic conditions like hypertension and diabetes, can be quite complicated, especially when done well. The definition of monitor is to observe and check the progress or quality of something over a period of time, or to keep it under systematic review. Monitoring your patients means keeping tabs on countless facets related to their health, from actions and behaviors to test results, all to ensure risks are being identified and addressed in a timely manner. With so many patients and only so much time in the day, it's difficult, if not impossible, for healthcare teams to know that they've addressed all concerns and mitigated all risks. Thankfully, there are many ways to engage your health IT to act as a watchdog on your behalf, helping to ensure nothing slips through the cracks. One of the best health IT tools available to you to monitor the care of your diabetic and hypertensive patients is the tracking and trending of associated clinical quality measures, or CQMs. Reporting on CQMs is a requirement of various programs like Meaningful Use, PQRS, and ACOs. CQMs use patient data from your EHR to demonstrate your team's ability to deliver high-quality care or to relate to long-term goals for quality healthcare. Hundreds of measures have been developed over the years, covering a wide range of healthcare topics. Measuring and reporting on CQMs relevant to your scope of practice helps to ensure you are delivering care that is effective, safe, efficient, patient-centered, equitable, and timely. There are several CQMs related to diabetes and hypertension, but two of the most heavily promoted are NQF-18, controlling high blood pressure, which gives you the percentage of hypertensive patients who have their blood pressure under control, and NQF-59, comprehensive diabetes care, which looks to identify diabetic patients who have poorly controlled A1C levels or no results on record. Analyzing these CQMs will help you determine how effective you've been in managing these disease states and improving outcomes. If you're doing well, you'll have a high or at least increasing percentage on NQF-18, and you'll have a low or at least decreasing percentage on NQF-59. Not all EHRs will offer all available CQMs, but if these two are offered by your software, we encourage you to choose them in the list you're reporting. One of the items you'll receive in the accompanying toolkit is a CQM selection tool that helps to guide your choice of measures by cross-referencing the 64 CQMs available in the Meaningful Use program with other quality and incentive programs. Not only will tracking and reporting on NQF-18 and 59 help you determine how well you're managing your hypertensive and diabetic patient populations as a whole, but you can also take these reports and drill down to individual patients to determine why certain individuals are or are not showing up in the numerator for the respective measure. Depending on the measure, appearing in the numerator can be either good or bad. Patient self-monitoring of blood pressure, or SMBP, is a valuable addition to the management and monitoring of hypertension. It is supported by the Joint National Committee on Prevention, Detection, Evaluation, and Treatment of High Blood Pressure, otherwise known as JNC 7 and 8, the American Heart Association, and the American Society of Hypertension. SMBP is especially useful for patients with poorly controlled hypertension. It can be used to titrate medications, improve control, and screen for white coat hypertension. Due to issues with office measurements, home readings may be an equal or sometimes better predictor of cardiovascular risk than office readings. This is exactly why we've encouraged clinical staff BP measurement retraining in a few other sections of this educational series. And circling back to the material Andy just covered, self-monitoring should also be used to engage, enable, and motivate patient participation in managing a condition that is often asymptomatic. When implementing SMBP in your practice, you may find it beneficial to designate a staff member to manage the education, support, and possibly the initial review of logs. Whenever possible, patients should be trained using their own equipment, which also provides you an opportunity to validate or calibrate their BP monitor for accuracy. For ease of access for staff and patients, maintain educational materials in your EHR as well as the patient portal. You will also see greater overall success in your home monitoring initiative by standardizing protocols that are captured within your EHR and by engaging these patients through support groups. Another tool available in the accompanying toolkit is a best practice guide for implementing SMBP in your office. Self-monitoring options have come a long way from the dog-eared diabetic log or even the most organized home blood pressure log, proudly provided by your engineer patients in Excel format with additional graphs. In addition to devices with internal memory, many have more advanced features, some of which are listed here. There are even electronic home monitoring companies to help streamline and implement the process. Often, all they need is the doctor's order, and they will supply the patient with a device, training, wireless access, and support. They facilitate results acquisition by ensuring HIE compatibility with your existing EHR, or by providing a secure login to a portal if your EHR vendor does not support HIE. In many cases, the cost is subsidized or covered by insurance. Not only can these devices be used for outpatient monitoring of diabetes and hypertension, they can help monitor high-risk patients and reduce readmission after a hospital stay. The result of employing this advanced technology is that there is an increase in patient-generated health data. Not only does patient-generated health data, or PGHD, come from doctor-prescribed home monitoring solutions, but there are vast quantities of biometric data becoming available from consumer-driven devices such as Fitbit and Apple Watch. In one survey, over 90% of patients indicated they would be willing to share health data if it could help doctors improve care, help other patients like them, or aid research efforts specific to their disease. There have been many predictions about what percent of all healthcare data will be patient-generated over the next few years. Regardless of the source, the main point is that the amount will be significant. The key challenge will be stripping out the clinically relevant portion of this data and getting it in front of providers in a useful way. To that end, some organizations are already working on incorporating this data into the EHR. This will even likely be a component of Stage 3 of meaningful use. In one study of PGHD, supported by an ONC challenge grant, the commercial product was used to allow 200 patients of a 24-physician cardiology practice to share demographic and clinical information and send and receive secure messages. This included transmitting key health data such as blood pressure and heart rate to the practice. They found that scores increased for the patient activation measure, which accesses patient knowledge, skill, and confidence for self-management. Patients took a bigger role in managing their health, in building knowledge and confidence, and in maintaining desired behaviors. It also enabled patients to take an active role in identifying errors in their data records and notifying providers to make corrections. Another health IT tool at your disposal for monitoring your patients is the Electronic Diabetes Registry. Though currently underutilized in the U.S., use of a diabetes registry is an initial step to controlling diabetes and is a basic requirement for structured, proactive care. If your providers participate in meaningful use of a diabetic registry satisfies one of the required public health measures. Connecting your EHR to a diabetic registry improves the consistency, quality, and effectiveness of patient care at the point of care. These registries allow individual clinics and practices to perform quality measurements and comparisons, as well as reveal opportunities for performance and clinical improvement. The data generated through a diabetic registry can be used for stratifying patients by risk, identifying gaps in care, implementing high-impact interventions based on clinical best practice guidelines, profiling providers at the practice or clinic level, and formulating comprehensive risk assessments and guideline-based interventions. There are several diabetic registries available. Some are regional and or tied to a particular organization or insurance company, and others are hosted nationally. We'll reference two respected national registries here, the first being the Diabetes Collaborative Registry. The Diabetes Collaborative Registry is hosted by the American College of Cardiology through their National Cardiovascular Data Registry, and in partnership with the American Diabetes Association, the American College of Physicians, and the American Association of Clinical Endocrinologists, and the Joslin Diabetes Center. It builds upon the growing number of patients with diabetes in the Pinnacle Registry and retrieves additional clinical data from electronic health records across a wide spectrum of participating providers. The Diabetes Collaborative Registry provides easy-to-interpret benchmark reports that validate the quality of care you provide and pinpoints opportunities for improvement. It marks the first time that clinical big data are being used across multiple healthcare specialty areas to create the evidence needed to provide high-quality prevention, care, and treatment options to patients with diabetes. Just mentioned as a partner of the Diabetes Collaborative Registry, the Joslin Diabetes Center also offers their diabetes registry and risk stratification system. Like the previously mentioned registry, this one aids providers in identifying and intervening with patients most at risk at developing costly, debilitating diabetes-related complications. A case study utilizing the Joslin Diabetes Center registry realized a 20% decrease in average per patient costs and overall costs that were 50% of the national average. An average reduction of 1 point in mean A1C and blood pressure, which can translate to an impressive 30% reduction of a patient's risk of developing complications. An increase in patient quality of life, including reduction in stress and barriers to self-management, and an improvement in a variety of process measures, including foot exams, frequency of A1C measurement, use of ACE inhibitors, and so on. In short, utilizing a diabetic registry can have a profound effect on the health of your patients. We previously discussed clinical decision support during the presentation on identification, but CDS should also be used as a powerful tool for monitoring your patients. For instance, alerting the provider or clinical staff to vital information regarding the ongoing treatment of patients already diagnosed. When CDS is applied effectively, it increases quality of care, enhances health outcomes, helps to avoid errors and adverse events, improves efficiency, reduces costs, and boosts provider and patient satisfaction. CDS is not intended to replace clinical judgment, but rather to provide a tool to assist care team members in making timely, informed, and higher quality decisions. Some providers use certified EHR technology to drive, receive, or trigger CDS in an external system. For example, sending data to one of the aforementioned diabetic registries. There is no definitive or comprehensive list of what can constitute CDS. ONC and CMS broadly define CDS to allow a wide range of innovative and effective decision support tools. Much like the paper chart of the past, the electronic health record can be used purely for documentation and data recording, but it is the potential for intelligent data management that really makes it a powerful tool. This intelligent filtering of data and presentation at appropriate time defines clinical decision support. Here you see the 5 keys to developing effective CDS. If you don't get the right information to the right person at the right time for it to make a meaningful contribution to patient care, you've missed your mark. When developing and implementing CDS in your office, ensure you're addressing these 5 rights, and you'll have successfully leveraged your health IT to work for you. There are many different types of CDS, from the common event-driven alerts and reminders you're likely already familiar with, to order sets, care plans, and protocols, and intelligently filtered reference information and knowledge resources. These can be used individually or in groups to provide guidance and support to the provider, the care team, and even the patient. One example of monitoring patients which benefits from employing CDS is the diabetes return visit. In fact, the whole purpose for diabetes follow-up visits is to monitor your patients for success of treatment, diabetic complications, and to direct changes which might improve care. There are more than 30 key components to a diabetic return visit, some of which are listed here. CDS can ensure completeness of your history and physical by using a note template which can include discrete fields for things like exercise history, symptoms of hypoglycemia since the last visit, and components such as eye and foot exam results. CDS order sets can also be used to remind providers of tests which are due, like urine screening or A1C, and guide orders for potentially beneficial medications like diabetic agents, lipid-lowering therapy, and antiplatelet drugs. Basically, using decision support for diabetes visits can make sure you complete all appropriate components. This standardizes care across providers and ensures guidelines are followed. A CDS starter kit for diabetes follow-up care is available at healthit.gov. It includes some great examples and screenshots and is referenced in the toolkit paired with this educational series. As you've just heard, there are many ways that health IT can be leveraged to identify and improve the health of your patients. Making the most of your technology means engaging patients to take an active role in their own health, improving the quality and convenience of patient care, improving the accuracy of diagnoses and, most importantly, health outcomes, improving care coordination, maximizing team effectiveness, and increasing practice efficiencies and cost savings. In short, healthcare teams should be leveraging the many aspects of health information technology to manage their hypertensive and diabetic patients. Failing to capitalize on the many ways health IT can be utilized means not maximizing your return on investment. Health IT can at times be daunting and overwhelming, but there are many helpful resources at your disposal and countless ways you can employ this technology to work for you, making your team more effective and, most importantly, driving improved outcomes. With that, we'd like to thank you for your time today. If you have any questions regarding the material we just covered or anything related to health IT, please contact us at one of the numbers or email addresses on this slide. While we give attendees time to submit additional questions, we'd like to take a minute to briefly explain the additional webinars in this series and to encourage you to sign up if you haven't already. Today was the third installment of a four-part educational series. The first session was a high-level overview of the many ways health IT can be leveraged to identify, engage, monitor, analyze, and improve the health of your hypertensive and diabetic patients. Today's session was the second of three deeper dives into the material covered in the first presentation. Additional sessions take a more in-depth look into using health IT to identify your patients, followed by a presentation on analyzing the data and using it to make important practice changes. As mentioned, we've also developed and collected a set of tools to accompany these topics and strategies, tools you can use to help you leverage health IT to improve outcomes. These tools are available on our website at www.mcda.org, and all of today's attendees will receive an email with these tools. Once again, thank you for your time today. We hope to see you again soon.